Everybody.
Hi, everybody. Welcome to the May 19th, 2020 meeting of the Passaic County Board of Chosen Freeholders. Lou, can we have a roll call? I don't hear you. Are you on mute?
Okay, how about now?
Yeah, I can hear you.
Yeah.
All right. Freeholders, Octor, Bartlett,
Here.
Best,
Here.
Duffy,
Here.
Lepore, Freeholder Lepore, Deputy Director James.
I'm not deputy director, but yes, I'm here.
I'm sorry, I'm looking at my wrong. And Freeholder James and Director Lazaro.
Here. Can we have any announcement of the public open meeting law? Open public meeting law.
Okay, the public notice, the Passaic County Board of Chosen Freeholders on April 28th, 2020 adopted resolution R 2020-372, which calls for the regular meeting to be scheduled for Tuesday, May 19th, 2020 at 6 p.m. and cancel the regularly scheduled meetings on May 11th, 2020 and May 26th, 2020 pursuant to the state emergency and public health emergency declared by New Jersey Governor Philip Murphy, set forth in Executive Order number 103, and further limitations on public gatherings set forth in Executive Order number 104. The board is conducting the regular meeting at 6 p.m. No other members of the public physically present and authorized under NJSA 20:4-12A in accordance with the Administrative Order number 20-1 issued by the Passaic County Administration, closing the administration building located at 401 Grand Street, Paterson, New Jersey, to non-essential personnel and to public effectively March 18th, 2020 at 8:30 a.m. If a member of the public wishes to place a public comment on record, please email public@PassaiCCountyNJ.org, stating your name, address, and matter to be addressed by the board by no later than May 19th, 2020 at 5 p.m. or submitting a question on the live stream available to all residents of the meeting. The clerk to the board shall read the same into public record. Moreover, some members of the board may be participating telephonically pursuant to board bylaws and compliance with NJSA 10:4-12-1 et sec. Official action will be taken. This public notice was published in both the Herald News and the Bergen Record on Monday, May 11th, 2020, and on all of the County of Passaic's social media platforms.
Thank you. And now we can, I guess, stand for the invocation and the pledge.
Yes.
I apologize, Director. If we could just move on to past the invocation. I didn't bring it in with me. It's on the.
Lewis, we could ask Dr. Gungil to do an invocation if we could.
Dr. Gungil, please.
Let us pray. Good and gracious God, thank you for bringing us together today to do the work of the people of Passaic County. Guide us as public servants to be true servant leaders, always working in the best interest of the people. May we serve with a pure heart, valuing justice, righteousness, and honesty. We pray for these things in your holy name. Amen.
Amen. And the pledge. Flag of our country salute. I pledge allegiance to the flag
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Liberty and justice for all.
And can we have a moment of silence before to remember all the men and women who have died while serving in the United States Armed Forces, and all of those poor souls who have lost their lives to COVID, including Ringwood Councilman Walt Davidson's son and Passaic Mayor Laura's mother-in-law.
Oh, Jesus.
Thank you. Have a motion for the minutes of April 28th, 2020.
Move it.
Roll call.
Roll call. Freeholders, Actor, Bartlett,
Yes.
Best,
Yes.
Duffy,
Here.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare.
Yes.
Yeah.
And now I'm going to hand this over to Dr. Gunghill to do her presentation.
Micah?
I'm sharing it now.
Okay.
You don't want to come around? She's got a PowerPoint. Oh.
Stand by 1 second.
You want to both share it?
I was wondering why you had your microphone, your mask on.
This guy.
I get it.
Standing behind me.
All right.
Because somebody can't handle the technology. Computer. Oh, step back.
Beautiful.
All right. Okay, so this is an update from the beginning of the COVID-19 pandemic until today. Next slide, please. All right, so as of this afternoon, these were this is a profile of the cases throughout the world, the United States, New Jersey, and also Passaic County. So we have, we're up to 842 deaths from COVID-19. Next slide, please. All right, we are still among the top 5 impacted counties in Passaic County, in New Jersey, sorry. And we've seen every day we are being the county that has the most new cases. So we're still in the middle of the pandemic, even though we have
What? I can't, it won't let me.
there's a lot of noise. But it does not mean that we are not getting cases. So 100 cases a day is a lot of cases anyway. All right, next slide, please. Next slide, please. Micah, thank you. This slide and one after it, they both represent New Jersey's statistics by municipality for Passaic County. And when you have all 16 municipalities represented, you could see that by far the city of Patterson has the most cases, having 40% of the cases in Passaic County. And they're followed by the city of Passaic and then the city of Clifton. Thank you. Next slide, please. The negative cases are similar as well. Patterson leading the charge with the number of negative cases. I mean, negative tested. It just means that a lot of people are now getting tested from the city of Patterson, and so you're seeing they represent a large percentage of people testing negative. So these two slides, this one and the previous one, have been using data from CDRSS, which is the State Registry for Communicable Diseases, and all municipalities are represented. The next slides that we're going to see, Micah, are, as I had mentioned a couple of times before, these slides represent the data from 11 municipalities that have provided data to me every day. All right, and they are the municipalities represented on this slide. And as you could see at the bottom of this slide, there is no data available to me for the other municipalities not listed. Next slide, please. This just breaks down the cases by health officer. And as you see, we have 6 health officers covering the county, and we broke it down just to give you an idea of the the workload by health officer. Next slide, please. This slide represents the number of cases by municipality, and as you could see, Ringwood has the least number of cases, and again, this represents only the municipalities that provide daily data. All right, and you could see Passaic is way up front, followed by Clifton and then Wayne, and the others, very few cases, but that's also in relation to the overall population. Next slide, please. Another way of looking at that data for the municipalities, again, you could see standing up front is Passaic, followed by Clifton. The third from the top represents Wayne, and then the other municipalities are represented, 8 municipalities at the bottom where there are fewer cases. Next slide, please. All right, so we've seen a lot of, and we've heard a lot of information regarding the long-term care facilities in Passaic County. We have 49 long-term care facilities, 25 of which are experiencing outbreaks right now. In the outbreaks, there are 990 residents of those facilities have tested positive for COVID-19. Of that, 305 residents have died of COVID-19. And one question that came up last time by Freeholder Best was the number of beds there are. So for the long-term care facilities that are involved in the outbreak, which are 25 of them, they represent 3,078 beds. So in that way, you can see that the mortality rate among the residents of these long-term care represented, the mortality rate is 32 per 100,000, per 100 population, which is similar in this case to the case fatality rate, which is 31%, which means that of the people who were cases, i.e. the 990 people, the people who died, 305 people, that represents 31% of the cases. Next slide, please.
Dr. Gungil, could I just interrupt one moment on that? I just wanted to point out to the freeholders, the Department of Health has put out a mandate that all long-term care facility residents and staff must be tested by May 26th, I believe it is, Dr. Gungil, correct me if I'm wrong. I would like to just point out the Preakness Healthcare Center, which, as you all know, but for anyone who may be on this meeting as well, is the county-owned facility. We've been testing residents for the last month. We've begun testing residents for a second time. We've had some residents that tested negative have now tested positive. Some residents that tested positive have now tested negative. But we have been ahead of the curve with the Department of Health on everything that we have done. And again, I say at every meeting, but I want to give kudos to Lucinda Corrado, our executive director, and the staff at Preakness. They are doing a fantastic job. And I just want to add as well that we have tested, I don't believe all at this point in time, but a vast majority of the staff as well. But we will be in not only in compliance with the Department of Health's mandate to have everybody tested, we will have begun the second round of retesting. Thank you.
Thank you, Mr. DeNova. Okay, so the next few slides are going to show you trends of daily cases by municipalities. And basically what we have done is we have created line graphs so that you could graphically see how the cases are declining in each municipality. Next slide, please. The first one is Bloomingdale. And as you could see at the beginning, and this is from April 1st to today, to May 16th. As you could see, there were a large number of cases. The largest one we're seeing is for April 2nd, but over time, you're seeing the trend down, which is a good thing, which is what we're trying to accomplish. Let's look at the next slide from Clifton. Clifton, even though we're seeing a tremendous number of cases, tremendous volume of cases, especially in the middle of April, which reflects what has been happening in New Jersey, we can still see a trend downward for the city of Clifton. Next slide. For Hilden, again, there was a lot of activity, but overall, we're seeing a trend down. There are days when we get an uptick. The uptick could be in response to additional testing, but the trend, again, is still down. So that's a good thing. Next slide, please. Same with Little Falls. And with Little Falls, it's more dramatic. You see around the 24th, 25th of April, there were quite a few cases, i.e. in this case, 9, 5291, etc., but trending down. If you're going to put a line from April 1st to May 16th, you will see that that line is sloping downward. Next slide, please. City of Passaic, same thing. Declining. Next. Fountain Lakes, declining. Next slide. Again, Ringwood, declining. Next slide. Wanacue, declining. Next slide. So Wayne is interesting to look at because at first glance it would appear as if there's nothing happening. They're declining, but at a slower rate. And one of the reasons for that, I would surmise, would be the high number of long-term care facilities in Wayne. As a result, I believe they have 12 long-term care facilities, and there's an outbreak in each one of them. So because there are a very vulnerable population in each of those places, though in the general population, Wayne trends downward, but because of that vulnerable population and such a large number of that population, it is hard to see that on this kind of slide. So, we always have to, we look at the numbers, and what we're trying to do is to see what is the message, what is the information behind this. And the information behind this is that Wayne has an inordinate number of long-term care facilities, which is skewing their data in a different way than the rest of the data. But that notwithstanding, we're still seeing a slight trend downwards. Thank you. Next slide. West Milford, again, a slide downward. Now, also recognize that around early May, we started to see an increase, and that is also because of the long-term care facilities and outbreaks that are taking place there. But overall, again, if you draw a line from when this began to now, the trend is also downward. Next slide, please. Next slide, please. Woodland Park, trending downward. There was a date, I forgot that, I can't see it because, but you can see that peak there, but that was an event. It was not a trend. So this trend is downward, as are the other ones. Again, there's another peak a couple of days ago. It could be that there were a number of testing sites open. I want to say that the peak that you're seeing, the largest peak, that might represent when the police officers and their families were tested, and so that could represent that's a cross section in a specific snapshot at that day. However, the trend again is still downward. Okay, next slide, please. Okay, good. So the next couple of slides are looking at COVID-19, looking at death data up to May 17th. Next slide. All right, so this represents all the municipalities from March 14th to now, and this is based on information from, again, the municipalities that have provided the information to us. All right, so you could see the city of Passaic leads with the death with 30% of the data, followed by Clifton, 22% of the data. Wayne with 23, Clifton with 22, and that is attributable to the fact that, again, Wayne has a very high percentage of long-term care facilities, which translates into a high percentage of deaths. As a matter of fact, in Wayne, as of today, there are 103 deaths in long-term care facilities. Next slide, please. All right, this is breaking down deaths by gender. As you see, 57% of people who died are male, 40% female, and 3, we have no data, we don't know. Next slide, please. By age group, again, for the same 11 municipalities from the beginning of the outbreak in Passaic County till today, you can see that the age group 80 to 89 years old represent 25% of those people who have died of COVID-19 in Passaic County. And that's followed by the 70 to 79-year-old age group. And then there is a tie. The tie is between 90 to 99 years old and 60 to 69 years old. So overall, you can see older people are more likely to be the ones who are dying from this disease. And an interesting piece of this data here is that the age group 60 to 69 is similar to 90 to 99. So, we're looking at how that is. In Passaic County, the oldest resident who has died of COVID-19 was 103, and the youngest was 20-year-old William Patterson College student. Next slide, please. This slide is just a different way of looking at how what testing looks like at William Patterson. So you can see that around early April, I believe it was April 11th, we had our highest day of testing. But you can see that the first few days, we started off slowly, and then we started to have a tremendous amount of testing, and then it started to fluctuate a little bit. The beginning of the very last peak would represent last Tuesday, which is when we went from prescription and Passaic County resident to no prescription. And that gave us a big jump in numbers tested as more and more asymptomatic people are deciding to come to get tested. Prior to that, everyone was required to have a prescription from a healthcare provider. Next slide, please. I think that was it. And that was it. All right, does anybody have any questions?
Thank you, Dr. Kungal.
Dr. Gungal, it seems to me that we've got a lot of data to tell us what we know, but the obvious question is, what don't we know? In other words, the whole notion of positive tests, negative tests, the largest group of people out there are people who've never been tested.
Yes.
So are there any other data, whether it's ER visits, for those symptoms, or whether it's hospitalizations or what have you, that can tell us anything about trends in what's going on with the virus in our county?
So hospital data is kind of hard to get a hold of. It's premium data, so we don't have routine holds of that data. But I know from a state standpoint, they're able to get that data, and they're able to see that it's trending downward, meaning that the hospitalizations are trending downward, the ER visits are trending downward. And I know from conversation and information from the hospitals in Passaic County that we are also seeing that trend downward for ER visits, hospitalizations, and ICU a stay at our hospitals due to COVID. But we don't have access to that kind of data.
Okay.
Thank you.
Anybody else? Mr. DeNova, do you have anything that you would like to add?
No, thank you, Director. I don't.
Okay, before we move on. Okay, can I have a motion to suspend the regular order of business?
So moved.
I second it.
Motion made by Freeholder Duffy, seconded by Lepore. James.
Sure. Where is I've got to get that out of my office so I can take my mask off.
Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes, twice.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare.
Yes. We're going to move on to guarantee resolution 2020-04.
Resolution authorizing the guarantee by the County of Passaic, New Jersey, of payment of principal of and interest on the governmental loan revenue bonds, Series 2020, Passaic County Guarantee, City of Patterson Board of Education Project, Green Project, Passaic County Improvement Authority, in the aggregate principal amount not exceeding $20 million.
I have a motion to open the public hearing on guarantee resolution 2020-04.
Move it.
Second.
Moved by Freeholder James, second by Freeholder Bartlett. Freeholders Bartlett,
Yes.
Best,
How many people are on? Is it just 5 of us or 4 of us?
we have six. We have six.
Okay. I recuse myself.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare.
Yes. Does anyone desire to be heard on guarantee resolution 2020-04?
Hearing no one, I move to close the public portion.
Hold on one second, Director Freeholder Lapore. For the record, at Passaic County NJ .org. We have not received any questions at that email address. And then also in the Q&A on here on the WebEx, we have not received any questions. Just for the record. Okay. Freeholder Duffy?
Yes.
And then who is Director? Can you ask for a second?
Can I have a second, please?
I'll second it.
Okay. Freeholders Bartlett,
Yes.
Best,
Recuse.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare.
Yes. Can I have a motion to close public hearing on guarantee resolution 2020-04?
Director, we
Yes.
actually have to do a motion to adopt the guarantee resolution.
That's after we close, clerk.
We closed the public hearing, sir.
Right, that's what, right, this is a motion to close the public hearing.
We have already done that, sir.
Oh, okay. So can I have a motion to adopt guarantee resolution 2020-04?
I'll move it.
Make that.
Okay. Moved by Freeholder James, second by Freeholder Duffy. Freeholders Bartlett,
Yes.
Best,
Recuse.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare.
Yes. Okay. Can we have a motion to resume the regular order of business?
Moved. Second.
Second.
I have Freeholder Bartlett making the motion, seconded by Best. Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare.
Yes. Okay. Freeholder reports? Anybody have any? No? Okay, go ahead, Freeholder Bartlett.
Thank you. So kind of first of all, again, as always, kudos to our entire team, Dr. Gungil and everyone. I'm hearing back feedback from constituents with families at Preakness, folks who have been up to our testing site, and it's uniformly positive. So thank you for that. Our census outreach continues. Actually, I'm pleased to say that Passaic County is right about with the rest of the state in its response rates. And we put together a great partnership that's coming up tomorrow. I want to let people know about. I was on a conference call with Congressman Pascrell and some other local leaders and the U.S. Census Bureau about 2 weeks ago. And we came up with a partnership between the Census Bureau, Channel 52, which is our Bangladeshi television station in Patterson, and Passaic County. The Census Bureau doesn't ordinarily allow for people to complete their census by telephone in Bangla, which is the language of Bangladesh. They have Arabic, they have Spanish, but Bangla is not one of their 12 languages. The Census Bureau actually is making Bangla available for phone census responses tomorrow evening, Wednesday, the 20th of May, from 6 p.m. to 9 p.m. And our Bangladeshi members of our Complete Count Committee, Neela Mahbooba, Fariduddin, as well as myself and others, are going to be on the station from 6 to 6:30 talking about the census in Bangla, mostly, not me, but mostly in Bangla. So hopefully that opportunity for people who may not be online, may not be confident enough with their English skills, the fact that they can respond in Bangla to the census by telephone is something that didn't exist until we made it happen on that call with Congressman Pascrell, and I hope a lot of people take advantage of that opportunity tomorrow. That's my report.
Thank you.
Director, if I may, Freelder Bartlett, I know they give the statistics countywide. Do they break it down by municipality as well?
They break it down by municipality and also by census tract. So countywide, we're above 60% response rate now, which is great because the enumerators aren't even out in the field yet and won't be until midsummer. But that ranges from a place like Ringwood that's over 70% down to, I don't want to say down to, but unfortunately Patterson is still, I think, below 40%. City of Passaic just hit 50%. So our mayors, our county level complete count committee are doing important work, but we're falling behind exactly the places that we thought we would, which is the urban core of our county, which is more heavily immigrant, working class, and transient individuals and families. So we're going to keep on doing it, keep on working on it. And we now have, it's expected the census count is going to be extended until October 31st. So we'll get to see the census count again next October. He'll make another appearance, but we'll have the chance, the school's going back into session in the fall, to keep on doing the outreach that we're still doing right now.
Thank you.
Okay, we'll move on. Can I have a motion to open the public portion of the meeting? Anyone who would like to be heard can reach us via social media. I'll give you some time to put your questions through.
Micah, maybe, Director, if Micah could maybe give a brief overview of how someone, if they are participating here on WebEx, would be able to raise their hand and be recognized.
Okay, but first I need a motion to open the public portion.
I'll move it. I'll move it.
Second.
Okay.
I'll second.
Motion made by Freeholder James, seconded by Freeholder Bartlett. Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore, Director Lazare.
Yes. Okay.
So if the public wishes to make a comment on the meeting, it is available via the Q&A portion. They can type in a comment in that area. We will receive it, and I will make sure that the clerk gets those questions.
Okay, so we'll give them a few minutes.
And while we're waiting for the record at the email address public@passaiccounty.nj.org, did not receive any other emails or any other comments in reference to also the freeholder meeting.
Okay, see, okay,
Director, public portion, close it.
yeah, we're gonna make a motion to close the public portion. Is it too soon,
Okay.
Lou?
I think we should just give it a couple more, at least give it a minute or so more.
Okay,
So I have a point of clarification. How many people are signed on besides the ones that I see here on my screen? Are there additional ones, Micah, or this is everybody actually on?
There are additional, you are a panelist, so.
Okay.
Yeah, there are additional attendees who are on the meeting. We have about 10 right now.
Awesome. Awesome. And the other question is this being live streamed anywhere, like through our district website or Facebook?
It's presently being live streamed on the on WebEx. The link was advertised via the county social media sites. So we will be posting the recording of this either on YouTube or the county's Facebook page when the meeting is over.
All right, but not live stream, correct?
Not live stream on Facebook right now, no, sir.
Okay, no problem.
We do have one question. Lou, do you want me to read it or do you want me to send it to you?
Thank you, Mike. I actually see it. So I will go ahead and read it into the record. It's from Vera Lazar, our friend from Woodland Park. A question regarding COVID testing. Does the county have any plans in the future to use the saliva test?
Director, if I may.
Yep.
So the saliva test was just recently approved by the FDA. County Council and myself had a conference call today with Dr. Brooks from Rutgers, and we've gotten, or we will be getting a contact to talk about the ability for Passaic County to get the saliva test and begin to use that.
Good news.
Again, Tony, just point of clarification for the saliva test. I'm sorry, Bruce. Isn't the saliva test much more costly? I heard it's 3 times the amount of the traditional nasal test, and the time that it takes is actually a little bit longer to get the results back than a traditional test. Is that true?
I do not have either of the answers to those questions. I don't know what the price is until we actually talk to the lab that would be doing it. And I don't know. We did visit Bergen County. I don't believe we asked how long the results were taking. If Dr. Gungill wants to jump in, I'm not sure if it takes any longer. It certainly is. The benefit is certainly the lack of PPE that you need. So basically, you need a lab coat, a mask, and a pair of gloves. The rest is up to the resident.
I thought the benefit was you don't have to have a Q-tip shoved all the way deep.
That is another ancillary benefit. I would agree with that. Yes.
Let me ask you this: what's the effectiveness? What's the percentage of positive, negative, and how accurate is that, Tom? Do you know? Do you have those numbers or no?
I don't know, but it is certainly questions that we will ask when we get connected with the lab that will be doing the testing.
I'm sure you will too.
I don't know whether it's an avenue we're going to go down, but it's certainly for reasons that Freeholder Best mentioned. The nasal swab can be uncomfortable, and it certainly is easier, and it certainly does, as I said before, reduce drastically the amount of PPE that we need to use.
I don't know. I've heard, down here watching this TV, it might be, it's 48%, but, I know you're going to investigate that. I got to tell you, I'm really thankful you're up there, and doctor, you're doing a hell of a job. Kudos to you and the whole team.
Thank you, Freeholder.
And that's all.
Okay. Have a motion? Did I close the public portion?
No, not yet.
Have a motion.
I'll move we close the public portion.
Second that.
Motion made by Freeholder James, seconded by Freeholder Duffy. Freeholders Bartlett.
Yes.
Best.
Yes.
Duffy.
Yes.
James.
Yes.
Deputy Director Lepore. And Director Lazar.
Yes. Okay, County Council, do we have any late starters or amendments or anything?
Yes, Director, we have one amendment and one late starter. The amendment is to Resolution N61, a resolution authorizing a contract modification to 8-Time Computing Inc. for supplemental management information system support for the Passaic County Prosecutor's Office. In the body of the resolution, it references RFP 19-016. It should be RFP 19-106.
Okay.
And then the one late starter is, which I emailed to the board, is a resolution authorizing the purchase of Packet Talk COVID-19 thermal imaging system for public safety measures in response to the public health emergency pursuant to NJSA 40A:11-11. Again, if any freeholders have any resolutions they want moved from the consent agenda, I would ask they just make a motion through you.
So we're adding N65 and amending N61. Correct. Okay. Can I have a motion to amend N61 and add late starter N65?
Move it.
Can I ask a question about N65? Where are those testing units going to be deployed? All of our entrances in the whole complex, or are we going to have a more limited number of entrances to the complex when we reopen?
No, they'll be for all of the entrances to county buildings. Anywhere, basically anywhere where we already have sheriff's personnel. So obviously some of the off-site buildings, such as the DPW garage or any of the remote locations where there would be nobody to monitor it, Parks Department, there will not be, but all of the entrances that will have some sort of security.
Okay, so both of the entrances at 401, the entrance to the
Actually, three at 401. We'll put one in the basement as well, so that judges and staff who park downstairs will also be scanned. Entrances to 71 Hamilton, 77 Hamilton.
How about the Board of Social Services?
Yeah, I'm going to speak with Mr. DeSimone. I haven't spoken to him yet regarding it. I would assume he would want it. It is a high traffic site. Obviously, there'll be the jail, sheriff's department. I'm sure I'm missing others, but
okay. No, I don't need an exhaustive list. I just wanted to understand where we were deploying it. I think it makes a lot of sense.
thank you.
Okay, so with the amendment and the addition, I have Freeholder James making the motion, Freeholder Bartlett seconding. Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore,
You said yes.
Director Lazare.
Yes. Can I have a motion to accept consent agenda N1 through N65?
Moved.
Before roll call, I had a question on number 10, Tony.
Yes, sir.
It's just the grant. Can you just give a little bit more information about how that grant is going to work for the general public?
Yeah, so as you know, the CARES Act allotted Passaic County $87 million plus to cover expenses related to the COVID virus and the pandemic. The Board of Chosen Freeholders have decided that part of what they'd like to do with the $87 million is offer grants to each of the 16 municipalities. So we're doing it in two rounds. The first round, we have allotted a little bit over $29 million to the 16 municipalities. The grant was based on population, so we based the allocation to each municipality based on their percentage of the overall population of Passaic County. Each town has been given a grant agreement. The governing body will have to adopt, and we have set up an email, Passaic County Cares at PassaicCountyNJ.org, where the towns will be able to inquire as to what are acceptable and eligible expenses, and we'll be replying. We've already started that. We've actually received Prospect Health's grant agreement yet. I'm not sure if we received any other municipalities. County council can jump in if we have, but I do know Passaic Park got theirs last night and sent us an executed copy already today. So on my calls with the mayors are very pleased that the Freeholder Board is going to share in that $87 million. And again, the money is basically used for mitigation purposes, covering additional payroll that may be directly related to the COVID outbreak. And again, while the guidance is somewhat vague, there are other areas that municipalities may be able to use the money. We did have this afternoon on our 5 o'clock mayor's call. We did have a representative from Senator Menendez's office, or his state director, on the call. So now the second phase of this is going to be on the revenue side, which is really where I think most of the municipalities, I know that most of the municipalities in the counties are going to feel the effects of the loss of revenue due to the COVID virus. So this bill, which has bipartisan support, Senator Menendez, Senator Cassidy from, I believe it's Louisiana, and other bipartisan support. Congresswoman Cheryl is going to sponsor the bill in the House, again, with bipartisan support. So we're hoping that bill gets some traction, because that really is going to be the area of most need to our municipalities and every municipality in the state of New Jersey. So I hope I answered your question.
Thank you, Tony.
Madam Director, I did not gather who made the second on the motion.
I don't know. Who made the motion?
We have Fielder Bartlett made the motion, and
I think Duffy seconded.
Duffy. Okay, Freeholder Duffy. Thank you. Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
Ames,
Yes.
Deputy Director Lapore. He says yes.
Yes.
Director Lazare.
Can I have a motion to move the personnel agenda?
Move it.
I'm sorry, may we go back one moment, because I'm not sure, Louis, did Mr. Cahill or bond counsel reach out to you regarding the Chapter 12 bonds that were on the agenda this evening?
No, I just have the guaranteed resolution.
Oh, well, we don't have color.
Okay, so I'm not sure. So we were told yesterday by the state of New Jersey that they are not approving any new Chapter 12 funding based on the COVID crisis and the crisis that the state will be in from a monetary standpoint. So I apologize, because I guess this just slipped my mind, but I'm wondering whether 15, 16, and 17 need to be held and not voted on.
Oh,
It's a little late now.
no, it's not late yet. We just vote on it.
Can we just vote?
Well, again, I think we can go back and again, I'll defer to county council whether we can go back and pull those 3 resolutions. Did we have a full roll call on the consent agenda?
No.
No.
We did have a full roll call on the consent agenda, but County Council, can we go back and do another?
Could we maybe just either have a 5-minute recess and let me make a phone call and find out what action we need to take or not take in this case? And I truly apologize. It's embarrassing that I'm just catching this now.
Why don't we take the 5 minutes and see what you can find out, Tony?
Thank you.
And by the way, there's parliamentary procedure if we want to go back and do this. So
Again, I'll defer to county council. I don't know, county council, you still with us?
Yeah, I think we could just make a motion to rescind 15, 16, and 15 and 16 and then 17, and that should be sufficient.
all right. Tony, you still want the 5 minutes, right, to do whatever you're gonna do?
He's muted
If I
already.
could just,
so-
if I could just take the 5 minutes, I'll make a phone call and hopefully it won't even be 5 minutes.
All right, good.
Yeah, go ahead.
Again, I apologize.
Duffy, you want to tell us some jokes while we wait?
Just remember, we're recording.
I would recommend that against that.
Yeah, mute your mic and then tell us.
There you go.
Better?
Well, let's take a moment and congratulate our colleague Assad. Or can we do that publicly yet?
It is now.
Good for
On the birth of his daughter yesterday.
Yeah. Now, can he
God, if I wasn't supposed to say that.
amend his census? Because I'm not sure he put it in his census count. He did it early.
Believe me, TJ, I already thought about that, but no, she was not in time for the April 1 census deadline. Otherwise, I'd be pulling strings to add one more to the Patterson census count.
I just think, the census is so important right now, especially considering how we got funding.
No,
The population over
right?
500,000.
Oh, yeah.
And right next door, our neighbors in Morris County who had
Not at all.
198,000, I think,
No,
population. They received $0, where Passaic County received $87 million. So that's shows you how important the census is.
Yeah, absolutely. I give that example now every time I'm talking about the census. And to their credit, Senator Menendez's bipartisan bill that Congresswoman Sherrill is sponsoring in the House actually has no floor on population for the grants to municipalities. Some of it's indexed to population size and to prevalence of COVID, but even Teterboro can get some funding under this new act if it passes, as Senator Menendez and Congresswoman Sherrill wrote it.
Nice.
Oh, maybe we can land bigger planes.
Sure.
Yeah, no, it's great because they're right over my house. I kind of like it. Bigger would be much better.
You moved
I was trying to think of a really small municipality. I didn't want to single out Prospect Park.
Well, you picked the smallest one.
Bro, yeah.
What, they got 20 people?
Something like that. I think there's a smaller one in South Jersey. It's like 16 people in a golf course, or at least that's what they say.
All right, freeholders.
There we go.
Thank you again. Yes, we should not vote on 15, 16, or 17. They should be pulled. Again, I apologize for.
So, Director, through you, I would just ask for a motion rescinding approval of N15 and 16 and 17.
15, 16, and 17?
Correct.
Okay. We have a motion to rescind 15, 16, and 17.
I got it.
Second.
I have a motion made by Freeholder Duffy, seconded by Freeholder Bartlett. Roll call, Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
James,
Yes.
Director Lapore, Director Lazare,
Yes.
Call of the Wild.
Okay.
Freeholder Laporte Hall? Where is Freeholder Laporte? Can only
He's in his
hear.
office. He's in his office.
He's here, but however he's connecting, he hasn't got his own microphone. We can all hear him.
All right, did we do personnel? Because I don't remember, Director.
I think we started this. Now let's start again. Does anyone want to move the personnel agenda?
I'll move the personnel agenda.
I believe Pat seconded.
Good.
Freeholders Bartlett,
Yes.
Duffy,
Yes.
James,
Yes.
Deputy Director Lapore,
Yes.
Director Lazare,
Yes.
For a little guy, he's really loud.
Can I have a motion to move the bills list?
I'll move the bills list.
All right, we have a motion by James, seconded by Lepore. Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy,
Yes.
James,
Yes.
Deputy Director Lepore, Director Lazare.
Yes.
Yes. Can I have a motion to adjourn?
I'll move it.
Second.
Motion made by Freehold James, second by Bartlett. Freeholders Bartlett,
Yes.
Best,
Yes.
Duffy, James,
Yes.
Deputy Director Lepore, Director Lazare.
Yes.
Yeah, you can.
Hey, everybody. Stay safe.
Good night, everybody.
Stay healthy.
Everybody.
Yes.